Hello everyone, my name is Chris Barber. I'm a strength coach at the Center of Optimal Restoration here at the Santa Clara Swim Club. Today we're going to talk about the shoulder, its anatomy, and some common injuries that happen to the shoulder in water polo. So the shoulder is a truly remarkable creation. It is a complex formation of bones, muscles, and tendons which gives the arm a great range of motion. The downside of having this great range of motion is the lack of stability. This lack of stability makes the shoulder a little more vulnerable to injuries. So in water polo, the most common injuries are shoulder injuries. So now we're going to talk about the anatomy of the shoulder. There's three bones: your humerus, which is your arm bone, your clavicle, which is known as your collarbone, and your scapula, that is your shoulder blade. Okay, there are four muscles: your infraspinatus, supraspinatus, subscapularis, and teres minor. And all these muscles originate from the shoulder blade and insert into the humerus. Okay, there are two joints in your shoulder: your glenohumeral joint, which is known as your ball and socket, and right above that is a small joint called the acromioclavicular joint, which is known as your AC joint. Okay, so with this great range of motion of the shoulder, the greatest among any joint in the body is due to the lack of bony congruency and a shallow cavity of the glenoid in which the head of the humerus attaches into. Okay, so with the shallow cavity of the glenoid, it makes it difficult for the head of the humerus, that ball, to stay in place when the arm is above the head in the overhand position. Okay, so with these small muscles that we talked about, more specifically now they're tendons, which attach the muscle to the bone, they create a cuff over the shoulder called the rotator cuff, and this helps move the arm. Okay, so when you hear about an injury to the rotator cuff, it's usually an injury to the tendons of the rotator cuff. So these muscles are small, but they are very important. They help stabilize the shoulder, meaning keeping that ball in the socket. Okay, so now we're going to talk about the scapula has two bony projections: the acromion, which attaches to the clavicle, and the coracoid, which is a beak-like projection that the bicep tendon attaches to. Okay, and right above the shoulder joint is called the coracoacromial arch, and the tendons and the muscle of the rotator cuff pass underneath that coracoacromial and attach to the humerus. And so that area is very small between that muscle and the coracoid acromion. So right between that is a fat bag called the acromial bursa, subacromial bursa. And the main purpose of this is to prevent friction between the muscle and the bone. Okay, so the rest of the shoulder is made up of ligaments and cartilage. The cartilage is known as the labrum, and it goes around the rim of the shoulder socket. Okay, so the few ligaments that are there in the shoulder, their main purpose is to make sure the arm does not go too far in one direction. And the shoulder is the only joint in the body that is not completely held together by ligaments. Okay, and then so the ligaments of the shoulder, they're not really the main reason why the shoulder stays stable. Okay, and the rest of the shoulder, so over the shoulder is a larger muscle that goes around the joint and the tendons and the ligaments, called the deltoid. So the deltoid's main purpose is to bring the arm in front and to the side of the body. It also helps stabilize the shoulder when you're holding a heavy resistance above your head. Okay, so now we're going to talk about some common injuries that happen in water polo. Okay, so athletes with a long history of participation in overhand and throwing sports like swimming, water polo, baseball, and volleyball are more prone to having shoulder injuries. And water polo are more prone to having physical trauma or overuse injuries. So physical trauma, with the arm is above the head, like in a throwing position, and somebody hits or grabs our arm while we're in that throwing position, and this may cause injury to the shoulder. Okay, so water polo players usually were competitive swimmers and have accumulated a ton of mileage on them before they even pick up a ball. So overuse injuries is this repetitive rotation of the shoulder over time, and like doing the crawl and the butterfly strokes. Add that on top of passing and throwing, this places a lot of stress on the shoulder and can lead to injuries. Okay, so with this repetitive rotation of the shoulder over time and overuse, those tendons and the ligaments start to become loose and or unstable. Okay, so the tightness of the tendons and the ligaments is very important to keep the shoulders to maintain its integrity. Okay, so with these, some people are just naturally born with these loose tendons and ligaments, just meaning that they're just a little more loose than another person's. Okay, so with this repetitive rotation of the shoulder over time and overuse, it does not make any sense to keep stretching out that shoulder by performing shoulder stretching exercises. So when we're stretching a muscle, say we're doing across the chest, over the shoulder, or above the arm, we're just kind of just stretching just to keep the body nice and relaxed, kind of bring down our heart rate, just a nice easy stretch. But some people, they stretch out too hard, and we're not only stretching out the muscle, but we're stretching out the tendons and the ligaments, and this can lead to instability. Okay, so with this, so I've seen people, especially they're stretching across their chest right before they get the pull above the arm, but some people, they use a partner that stretches them out. This can be extremely dangerous, because when you're stretching a muscle, you know that nice relaxed position, you know what that feels like when you get kind of a nice easy stretch, but that person doesn't know what that feeling is, and they might on accident stretch you out maybe a little too hard, not mean to stretch you out too hard. This can stretch out the tendons and the ligaments, lead to instability, and make you maybe more susceptible to having these injuries to the shoulder. Okay, so now shoulder, the most common shoulder injuries are shoulder impingement, rotator cuff tears, bicipital tendonitis, and labral injuries. Okay, so some other shoulder injuries are dislocations and partial dislocations, which they are rare, but they can happen. Okay, so a dislocation, so when the arm, so it happens kind of two different ways. We have our direct physical trauma, the arms above our head, we're getting ready to throw our arms cocked back, and somebody grabs our arm, hits our arm with a direct blow, and the head of the humerus can pop out of the socket. Another way we can do it with, especially with water polo and swimmers, with overuse injuries, these tendons and ligaments are getting stretched out too much, the head of the humerus is maybe moving around too much, and it'll pop out. It'll pop out of the socket. It doesn't happen very often, but it can happen. It can happen also too in overhand sports like baseball. You're throwing the ball, and you're throwing the ball a little, maybe throw the ball a little too hard, trying to throw as hard as you can. Your arm goes with the ball. It happens, but it's not something that happens too often. Okay, so shoulder impingement. Shoulder impingement is common, and it's more considered an overuse injury. So when the shoulder is moving properly, in that overhead position, the muscles and the tendons of the rotator cuff are moving smoothly with that bursa underneath the coracoacromium all the way to the humerus. But when we have shoulder impingement, that different things can happen. So the ligaments and the tendons, that shoulder is become loose, the head of the humerus is moving too much, and these could pinch off, especially that area of that small area of the muscle in the coracoacromium. That area is already small, it's rubbing against that area, causing it to become inflamed, and it's not moving smoothly in that area. It can also happen, you can move to different parts of your shoulder, it could be pinching off different muscles in that area. So some kind of pain indicators of that, it could be hurt to get to a certain point when you're raising your arm, doing different motions right here. This can be very painful in different parts of the shoulder, and these can be somewhat debilitating if they aren't taken care of early enough. Okay, so next we have rotator cuff tears. So rotator cuff tears are kind of classified into two different categories. We have our acute and we have our chronic tears. So acute is usually that right away pain. It just happens all of a sudden. So it can be from a direct blow, arms back here. We're getting that stretch of the tendons and the ligaments, and somebody grabs our arm as our body's coming forward, but our arm stays behind. Those tendons of the rotator cuff could tear off the bone slightly, leading to direct pain right away. Okay, it could also happen, say, you hop in the pool, or you're on dry land just playing catch, maybe you didn't warm up properly, didn't warm up enough. you try to throw the ball as hard as you can, and you get a pain shooting right away. So that's part of the acute pain. So with chronic pain, this is that over time, that repetitive rotation of the shoulder, the tendons and the ligaments get stretched out over time, causing little micro tears in the tendons that attach the muscle to the bone, and just over time that motion can become worse and worse. Okay. So some pain indicators, this is usually kind of more of a deep pain. It can radiate, it can start from the shoulder and radiate down to the elbow. So it definitely could hurt to any kind of overhand motion. You're playing catch, and any kind of swimming and it could also hurt just putting on your shirt. Okay. So now we have bicipital tendonitis. So bicipital tendonitis is common, especially with any overhand sport. It's considered an overuse injury, and so with our bicep tendon, originates down in this area by our elbow and inserts into pretty much the middle of our chest and our shoulder. So what's happening, the head of the humerus is not stable enough with those tendons and the ligaments, and what's happening, that head of the humerus, as we're coming in that overhead motion, the head of the humerus is coming forward, rubbing against that bicep tendon, causing it to become inflamed and very painful. So it also, say you're playing catch, you come across your body, the head of the humerus is coming forward, pinching that area, and this is extremely painful. So with that, so anything that you're crossing your arm over can be debilitating. Okay. So and then our last one is labral injuries. So labral injuries is considered overuse injury. How many of you have ever had that cracking, popping, that where your shoulder feels like it gets caught in a position? So that more likely is a labral injury. So we have that cartilage that's around the socket of the rotator cuff, that the head of the humerus is moving too much, maybe it's rubbing against that area, causing maybe little grooves or little tears in the cartilage. And what's happening, if those grooves get too big or they get a little too deep, the head of the humerus is getting stuck, maybe gliding, and it's causing that kind of popping, cracking feeling that you have in your shoulder. Sometimes it might not be painful, but other times it can be painful. But if you take a look at any kind of overhand athlete, you take an MRI of their shoulder, they're going to have little micro tears, little kind of cracks in their labrum. Sometimes it doesn't hurt, but sometimes it does. It is a very kind of a deep pain. Any kind of motion where you're lifting up your arm could get that cracking. So you're moving your arm, you get that crack, popping feeling. Okay. So with that, so in conclusion, so that tightness of the tendons and the ligaments is one of the kind of the most important things. So with those loose tendons and ligaments, the head of the humerus is moving way too much and can lead to injury. So with the proper shoulder rehab and prevention program, and catching these kind of problems early on can help save you from being sidelined for long periods of time. So in our next video, we're going to talk about some of these shoulder rehab and prevention programs that can help you out in the long run. So this is the shoulder anatomy and common injuries that happen in the shoulder.